For my patient's blood pressure, I'm going to use a blood pressure cuff that has a sphygma manometer attached. There's always going to be an artery indicator on your blood pressure cuff, whether it's the lines, a circle with a line through it, just an arrow. It doesn't matter what the indicator is. What we're looking for is that brachial artery inside the bicep. Here is where you want to align that. Go about 2 fingers above the crease of the arm when you secure this blood pressure cuff. Make sure that you're tight enough that it's going to stay on the arm, but you don't want it so tight it'll pop off. If you leave this loose where it's going to fall, you're going to just spend a lot of time trying to air it up. It's going to take you a lot longer to do so, and it won't be as accurate. So just try to secure it to where it does not come off, whether you inflate it and it doesn't come off on its own. So now that the blood pressure cuff's in place, I'm going to grab my stethoscope. These stethoscopes, you want to make sure that you point them into your external acoustic meatus, so into your ear canals, and these do rotate, so you can move them as needed. So make sure this goes into your ear, kind of push up and in to secure the ear canal, and make sure you cut off as many outside noises as you can. On the other end, we have our diaphragms. We have the adult side and the pediatric side. Make sure that these are secure. Sometimes these come loose and they can rattle when you're listening to a blood pressure, and that'll make it hard for you to hear. Typically on this stethoscope, the flat side indicates the open side. So you just want to make sure that the side you're listening for is open. You can put these in your ear and tap on it to make sure that that's the case. You can also look in here and make sure that the hole is present, and that'll tell you it's open. So when I put this in my ears, I'm going to take my adult diaphragm, 2 fingers on either side. Never place your thumb on your stethoscope diaphragm, as your pulse will generate through that, and you'll be able to hear your own instead of your patient's. So this will go here, just below the artery indicator. Secure it so that you can hear well. You're going to inflate your cuff to about 140. Once you inflate this cuff to about 140, if you already hear thumping in your ear, you want to go 30 above that. If you don't hear it, go ahead and slowly release. The needle will start moving, as you can see. What you want to do is listen. You're listening for the first thump. Once you hear that, you record the number. Slowly continue to release until you hear it thump one last time, and then you can release all the way. For this patient, I got 142/80. Your normal blood pressure for an adult patient is 120/80. And that is how to properly check a blood pressure oscillated for your patient. Ready? So for checking a pulse for a patient, you want to go radial first always. So find the radius on the outside of the arm located near the thumb. Place 2 fingers on that and you'll feel the thumping below your fingers. And then you want to have a seconds indicator on your watch. You want to count that number underneath your fingers for 15 seconds. Once you've got that number, you can release and multiply what number you've received by 4. That'll give you a full minute's worth of a pulse. That's the way to check a radial pulse. So to check respirations on a patient, there's a couple ways to do it. The main thing you want to pay attention to is total tidal volume. So you want to count either the inhalation or the exhalation. Don't ever count both, please. Just one or the other. This patient, I can see the clavicles, so that's a good indicator of respirations for me. I can watch there as he's breathing. You never want to tell a patient that you're checking their respirations. That'll cause them to breathe differently. It'll be an inaccurate reading. If you can't see the clavicles, you can place your hand on their shoulder here as long as they're okay with it. You can feel them breathe that way. Sometimes while you're taking a pulse on your patient, you can grab that hand and pull it up away from them. As you're checking a pulse, don't let go of the arm. Keep that in your hand and look straight down at respirations. They don't know what you're doing. They think you're still checking a pulse, so that you can get a respiration that way as well. The main idea is you want to count the respirations for 15 seconds and also multiply that number by 4. For oxygen saturation, we have a machine called a pulse ox. You never want to rely on this machine for a pulse. A lot of us get in the habit of turning this on, placing it on the finger of the patient and getting a pulse, as this will show you their pulse as well. The main thing you want to use this for is oxygen saturation. So oxygen saturation as well as respirations will determine the oxygen therapy you're going to use for your patient. So we turn this on. There's a blinking red light inside. You're going to place this on the nail bed of your patient's finger, have them relax that hand, and within a couple seconds or so, you should have your numbers generated. You want to make sure you have a good flow rate here at the bottom of the machine. That'll tell you that it's working, it's accurate. Here's your oxygen saturation, and your pulse rate will be right next to it. So for checking lung sounds for a patient, we've talked about a stethoscope and how to use it. So again, place this in your ear, make sure you're pointing into your ear canals, seal off the outside noises, diaphragm between your fingers, make sure it's open to the correct side. You want to check upper and lower lobes on the front as well as the back of your patient to listening for any abnormal sounds. Let's go ahead and take a deep breath for me. And again. Okay. One more. Okay. Then we'll go into the back side as well. Go ahead and take another deep breath for me, sir. Here. And then again with those lower lobes. So with checking your patient's pupils, we're going to use a pin light in this class. And by turning on the pin light, you squeeze the metal adapter here together. You guys see the dots here on the side. Please don't stress over those. That's just kind of an idea for you. Pinpoint pupils are when we start thinking about drugs that are heroin, an opiate. Perhaps the larger pupils could be an upper, maybe methamphetamines. Sometimes we're looking for neurological deficits. One pupil would be larger than the other. We'll get into more detail with pupils. The main idea here is don't stress over these numbers. Understand the difference between large pupils, small pupils, normal eyes. And so the way we do this test, I'm going to have you look straight at me into my nose, please. I'm going to get close to the patient's face, come from the outside of the eye in. I'm going to hold it for a couple seconds, make sure that pupil changes, and I'm going to go around to the other side and do the same thing to the other eye. Keep looking straight at me, please. And you want to make sure that both eyes equally react to this light at about the same amount of time. So then your pupils would be pearl if that were the case, pupils equally reactive to light. And that's how you check pupils.